in 1992, Dr. Terry Cromwell had the idea to build a safety net for the citizens of Lafayette Parish who were working individuals and working families, but yet did not have health care.
I was reading an article in the Journal of the American Medical Association. The title of the article was Free Clinics, Healthcare Now. It was obvious to me that this was the kind of clinic that could work in the Lafayette area. Everybody donated their time and efforts. And we were able to get it together enough so we could open for our first night of seeing patients in October of 1993.
So the Lafayette Community Healthcare Clinic was the access to primary care for our working, uninsured individuals here in Lafayette Parish.
The patients that we treated at the clinic were people that worked. Many of them had 2 and 3 jobs because they worked in the service industry. They were waitresses, they were babysitters, whatever the case might be. They were not in high-paying jobs.
My experience with that and the experience of a lot of other physicians in the clinic was that we were not only seeing patients, but we were saving lives.
When we closed our doors in 2016, it was under an accomplishment of our mission. We were established to serve the needs of the working uninsured in Lafayette from healthcare services through volunteers. Governor John Bell had been elected. One of the first things he did was expand Medicaid.
We, as the board, realized that our patients were going to be fully insured once the expansion took place in Louisiana.
Of course, we had a building. We had this very nice building, well-appointed clinic, but we had no one to see and no way to keep it open, and we ended up donating the building to Lafayette General Foundation with the hopes that one day the foundation, through Lafayette General, would find a way to reopen and provide services at that location.
The funnel for citizens is to go to UHC. That's the gathering. Whereas before we had the Affordable Care Act, citizens were just all over the place, and they found their way to the Lafayette Healthcare Clinic.
At UHC, we really have so many patients that come to the hospital, come to our emergency room, seek care in our clinics.
You can have insurance, you can have Medicaid, but there are no providers, and you still don't have access to health care.
You know, we have patients that come in our ER, and we want to connect them with a primary care provider, and we have waiting lists currently at UHC.
If you have access to primary care, a place for people to go in their own backyard, they're not going to show up into the hospital emergency room. They're going to seek care sooner.
With opening an additional clinic, we anticipate that we would be able to see probably anywhere between 10 to 15,000 more patients a year. Patients will be connected with a primary care provider, a physician that they'll be able to see when they have a sore throat, if they just need a wellness visit to keep them well.
The local hospitals do what they call community health needs assessments, and those assessments show that our clinic is the center of the greatest need. The people that live in those communities, the Freetown communities, the Puerto Rico communities, the people that work in the downtown area in Lafayette, they finally are going to have access to stable primary care services right in their own backyard.
Healthcare has been provided there since the 1940s. First the saloons through St. Anne's Infirmary, then the clinic, 20 years of free health care, and now Lafayette General is taking up the cause.
It was important to the board, it was important to the volunteers that the mission would continue, and Lafayette General Foundation is making that happen.
We need everybody's help in order to raise the funds necessary to bring this clinic back to life.
All of the money raised for the clinic is going to go toward improvements to the building and to equipment that we'll need to run the clinic.
Help be part of the revitalization of a very historic clinic